Welcome to CharityVillage Connects. Today we're doing a checkup on our mental health, discussing how professionals in the nonprofit sector are coping with the stresses and challenges in the workplace, and what nonprofit leaders can do to support their well-being. Joining me today is Steve Lurie. Steve was formerly the Executive Director of the Canadian Mental Health Association Toronto branch. Now retired, Steve is an adjunct professor at the University of Toronto and continues to write and lecture extensively on mental health policy issues. Steve was recently named to the Order of Canada for his contributions as leader, scholar, and advocate, and was honored by CMHA as one of Canada's difference makers in mental health and addictions. Welcome, Steve.
Thanks for having me, Mary.
Well, last February, we published our first podcast episode, Tackling Workplace Mental Health, and when we talked to you, this year we're looking to do a sort of check-up of sorts. Would you say that we're in a different space today than we were a year ago? What changed from your perspective? Is the pandemic continuing to play a factor in the mental health of Canadians?
I'd say that we are in a similar space. I think to some degree, some of the issues that we encountered during COVID may have actually gotten worse. We hear anecdotally of many workplaces, particularly in the health and social care sectors, who are really struggling around retention of staff and avoiding burnout. I think that's offset by the convenience factor that people have learned and benefited by being able to provide some services virtually. And, there is information that in some cases, the use of the web, particularly if you can get your client groups to, both have a data plan and know how to use a phone or a computer, it can actually increase accessibility and increase effectiveness of services. But I think the sector is still struggling to provide the services they did pre-pandemic and adjust to new ways of working. I've often said the mental health system was under strain prior to the pandemic. We haven't had the level of investment that the Mental Health Commission recommended we should have in 2012. There have been some steps toward it. I mean, if you look at the not so recent federal health accord, the one from 2017, it added $5 billion to provincial mental health coffers over a 10-year period. We're in year 5, but that is well short of the $3.1 billion annual investment that was required to improve access.
Well, I guess I've heard from other guests that we've interviewed for this podcast that, in a sense, the resilience that people had naturally at the time that the pandemic hit has now worn down. So the stresses that we're experiencing are actually impacting people who've gone through so much over the past 3 years that really they're suffering more. Would you agree with that?
Well, yeah, I mean, I think, people had this sense early in the pandemic that it would be over. And then we live in this paradox where in some ways it looks like it's over. You look at a Raptors game and you see 20,000 people in the stadium without masks. But at the same time, if you look at what happened this fall, particularly in Toronto and other parts of Canada, we sort of had a triple threat of COVID still present in the population, the flu, and the RSX virus. And so if you're, let's say, a worker in the social services or healthcare sector, and you have young kids, you've not only started to continue to worry about, well, will I get COVID or will members of my family get COVID? How do I keep the grandparents safe? All those kinds of things. What are the conditions at work? But you also now have flu, and I think what happened is that the workplaces are actually struggling even more because it's a triple threat. You've got the flu rates they're starting to tail off now, but that plus COVID. And then, anecdotally, I've heard that particularly people working with seniors in the long-term care sector, there's a lot of COVID infection going around. So, I think People's reserves have been challenged because when COVID hit initially 3 years ago, people thought, well, and I remember being parts of teleconferences with colleagues saying, well, it's only going to last 12 weeks. Well, it may end up lasting. I don't want to depress your listeners, but it may be with us, according to epidemiologists, for many, many years to come. So not 12 weeks, maybe 12 years. And so the issue is, how do you adjust to that? And as I said previously, on the positive side, the convenience factor and the effectiveness of virtual care has enabled scaling of some services that just weren't available to people on a timely basis. But at the same time, if you're providing those services virtually, and you're still wondering about are your kids safe in school? Is your partner working in a safe environment? Your resilience is challenged, and I think the many workplaces have struggled because if they were short of staff last year, let's say, now they might even be more short-staffed, and then the question is, where do you find the time to do sort of the team building exercise, the resilience piece that fosters workplace, because you actually have more pressure to keep staff on the road providing services. So I don't think it's become easier. I think people are now more conscious of what are some of the things they need to do. And but for example, I'm not aware that the sector, let's say the charitable sector writ large, has organized itself around here are online resources for resilience. Here's the team building stuff you can do. Now, CMHA National, as I've mentioned previously, they've got a program called Not Myself Today, which is a wonderful program. It's very low cost, and it enables organizations to have discussions in teams about how people are doing relative either to issues in the workplace or issues outside the workplace. So I think, there are resources available. The psychological safety standard that the Mental Health Commission developed and the resources for that, those things are available for employers. But the challenge is if you're just, struggling to keep your workforce at a level where you can provide services, training and supporting your staff around resilience and burnout is more of a challenge than it's ever been.
I can't agree with you more. And even CharityVillage has even offers now mental health e-learning courses for employers to be able to help support their staff. So we're seeing that have a big uptick in terms of interest as well from the community. But it is very challenging when the staff itself may well be smaller than it used to be, and recruitment is tough, to actually have the resources and the wherewithal as a leader to be able to implement some of the recommended policies and supports that are available. So you couldn't be more correct. Are there any new studies or research that listeners should be aware of in terms of the current trends related to workplace mental health?
Well, I haven't had the luxury of sort of combing the internet to see, but I would imagine that there may well be studies that have been published by various organizations nationally and internationally, and I would suggest that people just put workplace mental health into their search engine and see what comes up. I remember reviewing some of the material from last year, and many of the things we've talked about in this podcast and last year's are still factors that the recruitment piece is a continuing challenge. Keeping people present in the workplace. We knew again, prior to COVID, that presenteeism was an issue in the workplace because people were worried about things like aging relatives, their kids, the status of their personal relationships, and that often took away from their ability to focus. So if anything, I suspect things have have gotten tougher. That it's and then the question is, I think more people are probably in the space of saying, well, when is this going to end? Like, when can we get back to normal? And again, it's that paradox of seeing people, going around without masks, going to sporting events, going to restaurants, going to bars, going to movies, going to the theater, but the threat of viral contagion is still there. And then, what we're also seeing, and there is a literature emerging on this, people who are getting reinfected with COVID often have complications, and long COVID has an impact on people. So, I'm not sure what the state of equilibrium will look like. Now, I think at the same time, some of the newer efforts to do a broader recruitment approach, including bringing in international trained workers, bringing in the plans here in Ontario to recognize credentials from other provinces. That may allow for some rebuilding, because you're going to get people with new ideas who've come from other jurisdictions. For some people, I think particularly graduates, a first job, people who can come, who've done similar work in other jurisdictions, if their credentials are recognized. I remember way back when at CMHA, we were looking at, how do you counteract the requirement for Canadian experience when you're hiring your staff? And we came up with the idea about, well, what about adding a value to experience gained in other jurisdictions? Because that broadens, the capability of your workforce. So I think, the workforce will continue to evolve. I think the other issue that is facing the workforce is that, people of my generation are starting to retire. And so you're seeing at senior levels in organizations a changing of the guard. So you add that to, just basically being able to recruit frontline staff. And I think, because of the way the sector's organized, many small organizations in particular, they haven't had a workforce development plan where they're grooming, successors in management. Now, at the same time, in the sector, many people, went back to school and took courses and things like that. But again, this is an opportunity to think about, we're on the cusp of a generational change in our workforce. That's going to include people in leadership who leave the workforce because, and there is evidence that actually people who were thinking of, early retirement, at 62, 63, based on what's gone on the past few years, maybe they've gotten out at 60 or they've gotten out at 58. Now, I think therein lies a bit of an opportunity. I suspect that, many people, once they retire, some of the gurus of mental wellness saying what's really important in life is having purpose. And so I think many retirees will be looking for opportunities to give them meaning in life, not necessarily 5 days a week, but I think there should be attention given to, can we make it relatively easy for those retirees who wouldn't mind doing direct service to come back into the workforce, have a training program, be supported. And even though it's part-time, I think there's also an opportunity to think about, are there jobs in our sector that could be done by skilled volunteers? Again, targeting seniors. You need to put the supports in place and the training in place. But I think there is an opportunity to think through, how do we, in this era of high tech, how do we do what Ken Gergen talked about 30 years ago in terms of provide high touch services? Because many of our services are based on people being able to talk to each other, to see each other, to be with each other. At the same time, if we look at what's happened in Japan, particularly in healthcare and long-term care, the Japanese have made very effective use of robotics. And so, that's an area, particularly in dealing with populations who are frail. How do we both access the right types of robotics? And then, of course, you need to be able to train people in using them, keep the equipment working. But, I think this is the time to sort of step back and say, where do we think the workforce will be 10 years from now? What are the things we should be doing? And obviously, some of the larger organizations, do this work on their own, but I think this is work that the sector could be doing. A think piece on, what's the workforce of 2030 to 2050 going to look like? What are the jobs? What are the changes we see? I think these are all opportunities to think these issues through.
So let's just, you've kind of taken this conversation in the direction I was hoping to address now, to check in on the frontline nonprofit workers. You sort of touched on that. They encountered so much difficulty during the early days of the pandemic. What are you hearing in terms of how those folks are managing today? Have things become better, or have they gotten worse? I think I know what you're going to say, but I'd like to hear your thoughts.
Well, I think there are sort of two things that have happened. I think, I've had the most contact with my former organization, and there have been a lot of people who've retired. But at the same time, there are a lot of new people that they have been able to recruit new staff. There have been challenges. So, I think we're seeing some workforces that are revitalizing, new skills. But again, as I said earlier, the challenge is, how do you keep the lights on, essentially, and provide the services? At the same time, this is a good opportunity for organizations to say, so what have we learned about virtual care that we can scale? For example, just thinking about, if you've got less staff, prior to COVID, we used to have team meetings of our assertive community treatment teams and our early psychosis teams. They had to meet daily. So that meant there was probably a 2-hour commute to come into the office and then sit around for an hour and review clients and then go out and do a visit. So now, even if you're doing in-person visits, if you can make your team meetings virtual, you can pick up a few hours a day. So I think it's really important for organizations to look at, like, what are the efficiency and effectiveness gains they can get through operating more virtually, but at the same time, what are the things where they really need to emphasize, the in-person contact. And then something in between is, and we found this with some of our service users during COVID, just a phone call, checking in, meant a lot to people. And so, is that something that managers should be thinking of doing, every few weeks? I mean, even though you've got your formal team meeting, just picking up the phone and saying, how's it going? What's working well? What isn't working well? The late Brenda Zimmerman, who was a great asset to our sector, used to have what she called the ecological model of strategic planning, but you could boil down your analysis to two questions. What do we want to grow? So what are the things that we're doing in the organization that we really want to grow, and what are the things we want to stop doing? And I guess the third element is, what are the things that we want to maintain? So, sort of thinking your workforce issues through in those terms, but, clearly looking at what's the impact of virtual care, what's the impact of virtual management, more online training. For example, many organizations still think, well, we should put our staff in a room and, train them for weeks on our service delivery. Well, there was evidence years ago that actually online learning coupled with group discussion was a very, very effective way of training people up. And it was much more effective than, basically classroom instruction or online learning on its own. So, I think managers and leaders need to be thinking that kind of stuff through. If we're doing staff training, what are the options for that? How much, and again, I think it's that combination of providing the content, and the advantage of having online content is that people can go back to it. So that it's not just a one-off, oh, I missed it, I wasn't paying attention for that 10-minute period. But and I know we did some work for the justice sector, developing a sort of an online training approach for lawyers and police, and it had tip sheets in it, and you could click on the tip sheet. So I think, thinking through how we do our training, both in terms of getting people ready for the workforce, as well as when they're in the workforce. I think some of the institutions of higher learning have struggled with this. So for example, I teach at the Toronto Faculty of Social Work here, Factor in Wintash, and we've had discussions because, ironically, I think for many of us, the online learning, Zoom courses worked pretty well. And ironically, there have been discussions within the faculty about the importance of in-person learning. So, we've shifted back. But what I've heard from students is that the ability to learn online actually works for them to some degree, because many of them, given the high cost of post-secondary education, have to work. So if you are going to school 2 days a week, and then you need a part-time job simply to pay the rent and pay your tuition, the ability to learn online and get your course credits, is seen as an asset. So I think, even, professional schools are going to have to relook at, how do we provide blended and hybrid options for people? Because you run the risk, of and it's a real challenge. I mean, if you're a student who's burnt out before you graduate, what kind of contribution are you going to be able to make in the workforce? So I think we need to be thinking about, and this is again where I think the sector could engage, the professional faculties about both, credentialing education in terms of the things you need for, to be able to do the work in the sector, but also the ongoing training.
In your opinion, what are the most important supports that nonprofit employers have in place for their teams? What can organizations go beyond simply pointing staff to their employee assistance program and actually have in place for their team for their better well-being and their mental health?
Well, I think, EAPs are an important part of the mix, but, I'm not sure how many organizations in the sector actually have them. And an adjunct to an EAP is, a process for critical incident debriefing, because stuff happens, and people do need to be supported when, an unfortunate event occurs in the context of their professional life. So, I would imagine that, if you're working in seniors care, sometimes some of the people you're working with all of a sudden have a turn for the worse, or they die. And let's say you've been even a Meals on Wheels visitor, and you got to know that senior very, very well. And we've all heard the testimonials that come from seniors about how much they appreciate their Meals on Wheels visitor. So what kind of processes do the Meals on Wheels programs have for staff debriefing around loss, around, change in client status? Similarly, in the mental health field, it's not common, but you lose clients, right? People die because they attempt suicide, or sometimes they die. I mean, it was interesting. We did a study at CMHA years ago. We found that 78% of the clients who died in our service died from chronic disease, not suicide. But again, staff incur losses when you're working with a client. And yes, you can be more proactive, and that's what CMHA developed over a period of time around working with our service users around their physical health issues as well as their mental health issues. but stuff happens. So I think EAPs can provide a service just to support people generally about what's going on in their lives. Again, as I said, the notion where some EAPs actually specialize in doing critical incident debriefing. And I think if your EAP doesn't do that, or you don't have an EAP, there are materials available around how to do critical incident debriefing. And again, I think in many communities, there's probably somebody in the sector who's doing that kind of work and who's doing training on vicarious trauma and trauma-informed work. And I think there are opportunities for partnerships. I mean, here in Toronto, CMHA Toronto has done a lot of work in that area, and they have staff who are available to work with other sectors and other services on sharing the knowledge. I think beyond EAPs and critical incident debriefing, I think organizations really should look at how do they do the supervision that is required, because I think there are benefits to sort of team-based supervision, and as I mentioned earlier, things like Not Myself Today provide really good tools for teams to have discussions about challenges both in the workplace and outside the workplace. But how often does the team get together? And then what kind of individual supervision is there beyond that? And then, as I mentioned earlier, beyond individual supervision, to what extent are leaders and managers checking in just to see how things are going? And I think if I was sitting there listening to this, I'd say, well, geez, I'm already running with all my barrels. How do I find the time? Well, some of this is you've got to make the time for the important stuff and decide the stuff that's less important. And I was talking to a colleague the other day who works in the consulting field, and she was saying that there are some real advantages to the ability to go virtual because you actually do pick up time, and so you're able to decide that time that I've picked up now that I'm home. Am I going to do something at home so that it doesn't have to wait till I finish my job, or am I going to do something related to the workplace? And so I think people just need to sort of step back and say, okay, what's our way of working now? And then ask some questions. And the other, important thing, and I remember, so some of this isn't really new math. It's just, when do you ask the question? We, long before COVID, and what sort of got CMHA into the trauma-informed care and the helping people deal with vicarious trauma, is we did questionnaires for staff. We did surveys for staff, particularly after critical incidents. And so what they said, yeah, the AP was really helpful. But the theme that came out again and again and again, and what motivated us to do the work we've done in trauma-informed care, was people said, I really need help around the issue of resilience, as you mentioned earlier. So I think organizations need to be thinking about, like, how do you build a resilient workforce, particularly with, what we know is going on now. And because we're going to see, certainly, every fall and winter, we're going to see an uptick in respiratory infections, some of which will still continue to be COVID, but others which will be flu. And, so around resilience, I mean, it raises all kinds of things like, for example, what's the company policy around vaccination? And that's become contentious. Some people are saying if you even specify that I need to be vaccinated, that's an employment law issue. But organizations need to have that conversation. And for example, pre-COVID, CMHA offered flu shot clinics for both staff and service users. So, what do you do there just to protect the physical health of your staff? And then what are the variety of strategies you can employ to protect and enhance the mental health of your staff?
On last year's podcast on mental health, you discussed radical acceptance. and to your point, resilience as important approaches to dealing with uncertainty. Can we revisit those concepts, what they mean, and how individuals and organizations can foster these skills within the workplace?
Yeah, well, there was a toolkit I think that I sent along after the podcast last year, and that's where the concept from I think it was called Dealing with Uncertainty, and I mean basically the psychologist who developed this approach said there are things that you just have to recognize you can't change them, and so how do you deal with it? Um, and so this I think needs to be a conversation that we have about understanding like we now live in an era where for the foreseeable future, for every fall and winter and even in the good weather seasons, there is going to be the risk of COVID and other respiratory illness that have the potential to decimate a workforce. So it's one thing to say, geez, I wish this was over. But it's another thing to say, look, this is the environment we're living in. How do we adjust to it? And understanding the notion behind radical acceptance is understanding there are just things beyond your control. So, we cannot control whether the COVID virus is going to stop at some point where it won't even be a factor in the population. So again, then if you can't control the incidence of COVID, for example, then it raises questions about, okay, so what can you do about it? So then it's the question of, okay, what are the things my organization can do to keep staff safe? So vaccinations, masks, and obviously mask mandates are contentious. So that's an individual organizational decision, but it's also an individual decision. And, certainly the public health advice, which says, if you're going into a crowded space or a place where you can't physically distance, having a mask in addition to being up to date on your vaccinations is going to protect you. So even if organizations don't want to mandate that stuff, even saying, hey, staff, you should consider this, and, we will continue to make connections and give you time off if you need to go get your COVID vaccinations or your flu shots, or we'll organize clinics. There will always be a supply of PPE and masks for you. And we would encourage you to do what you need to do to keep yourself safe. That, I think, creates some space for people to say, well, hey, my employer cares about my physical health and my mental health due to the stress of living in a COVID environment. There are instrumental things they are doing. The other thing too, and we saw evidence of this during COVID, is flexibility about time off to take care of ill family members and things like that. Those are things that people really appreciate. So if your kid's home from school because COVID's been rampant in the community, allowing people to substitute vacation days for sick days and things like that. Those are things that organizations can do that make accepting the current situation easier. So it's an opportunity to look at like where are our policies sort of inflexible, and I think around time off, I think around sick leave. That those are areas where I think organizations can be creative, and again you can talk to your staff about what would be important to you. Now at the same time, you have to consider, okay, well, if what happens when a staff can't do client visits, can't show up at the drop-in center. So that's also where you need to have in place scheduling and redeployment plans to deal with issues in your workforce. But again, we developed these things, again, thinking they would be temporary when COVID hit. But now it's, they're probably part of the fabric. So, revisiting your redeployment plan. So, how do you keep your residential care facilities staffed, and how do you move staff in and out when you need to? those are all things that, people figured out how to do when COVID hit. And I think it's an opportunity to revisit those kinds of practices to maintain the workforce and support the workforce during what we think are going to continue to be uncertain times.
I wonder if you could, I know you shared in our last discussion, but perhaps you could share again with us and our audience some of the resources and tools that are available to nonprofit employers and individuals to promote better workplace mental health and well-being.
Well, as I mentioned, there is the Not Myself Today, which is, I think, notmyselftoday.ca. That's a really good resource. There's material about the psychological safety standard and toolkits, both the standard itself and toolkits on the Mental Health Commission website. For those employers who, have at least a bit of money to sort of get a professional assessment of what they might need to do and what's possible. The CMHA Ontario division operates a program called Mental Health Works, and they will come in and do an assessment of the workplace. And so this is the kind of thing where, at the community level, potentially organizations could come together, and then maybe they could work out an arrangement with CMHA Ontario where a group of employers could be assessed. And then you could develop a community of practice at the local level in terms of sharing resources. And then again, as I said earlier in the podcast, if you just put, workforce mental health, plug it into a search engine, the nice thing is that even before the recent advent of artificial intelligence, Google would take you to many, many sites, and you can look at, what's going on both locally and internationally. So there are resources out there. I think the issue for people is identifying, that this is something I need to deal with as a leader. B, I need to make the time to sort of consider what's going on. And that, again, as I mentioned earlier, should involve consultation with staff about what their preferences would be. And then you try and figure out something that's workable for the organization. But, keeping our workforces present, productive, supporting the work that they do in the realizing of the mission of all the organizations in the voluntary sector. That's the key leadership imperative, for the 2020s and the 2030s, I think.
And I just want to close by asking your opinion on what you think the most important thing that a nonprofit leader could do today to better support their staff and volunteers' mental health.
Ask them. I think the notion of engaging with people about how's it going, what have we got in place that's helpful? What have we got in place that may not be so helpful? Back to, the late Brenda Zimmerman's ecological model. What are the things we need to grow? What are the things we need to stop doing? For example, and this is it's a bit tangential, but I think it's relevant because, if you look at what's going to happen in the workforce, we're seeing, notwithstanding what's going on in the media about federal government contracting and stuff like that, we're going to see continuing demands for accountability and continuing demands to use data to justify your existence. So I know that at CMHA, while we've had robust data systems for many, many years, many staff didn't see the value of putting client information into the MIS. And they saw it as a time waster. And they said, look, I could be out helping people, but instead I have to do my notes. I think leaders need to address that issue too. And it's how do you take the data that your staff are plugging in around what's happening to clients, and how do you build it in to your team meeting process? So, what clients are being admitted to hospital, what's going well, what isn't going well, so that people begin to see, the data actually has some meaning. So for example, and CAMH is doing a wonderful job. Nadine Reed is leading an evaluation in Toronto of the community crisis service that is being set up by the city to reduce the need for police to do wellness checks and intervene in crisis. Well, there is an incredible rich pool of data around both met and unmet needs, and what was the role of these crisis teams? How quickly were they able to get to the scene? What was the average time spent dealing with an intervention? What were they able to do on site? What were the kinds of things? Where do they need to make referrals to for follow-up? But that's really critical information. So we now have, and there's lots more work needs to be done that's to standardize the data between what the police collect and what the community collects. But, if you're a staff person working in that environment, you now have a treasure trove of here's the impact I'm having in my day-to-day job. So I think, leaders need to pay attention to data. We hear a lot about quality assurance. That's, again, another way that people can make their workplace more effective. I'll give you another example. CMHA has had a strong quality improvement program for many years. And what we used to do is ask teams to identify things that they thought weren't working and then brainstorm through, in the context of a team meeting, what might make a difference. So we operate crisis beds. They're referred to as safe beds, but these are beds for people involved in the justice system with a mental health crisis, or just a mental health crisis in general. And if you don't need to be admitted to the hospital, here's a place for you to stay for up to 30 days if necessary, and wraparound supports. Well, what they found was, first of all, there are very few safe beds in the system. And they found it was taking 2 days when somebody left a safe bed to have it ready for the next occupant. And simply by sitting around in a team meeting, they did an analysis. Well, what's causing this? And they realized what it was is they would contract with external cleaners to come in and clean up the room. And so the room cleanup was dependent on an outside provider's schedule. So what they decided to do as a team was, we'll do a general cleanup ourselves when somebody leaves. And of course, if the room really requires a major cleanup, then of course we will have to secure an outside resource to do a deep clean. But most of the time, it was just basically clean up the room. And so what they were able to do was reduce that 2-day interval to 3 hours. So there's an example of, engaging your team in fact finding and talking through problem resolution.
So how does that apply to workplace mental health, the actual team's mental health?
Yeah, I think the issue is, how do you engage people in quality improvement, and how do you turn that into a good news story? It doesn't mean bad things don't happen in organizations, but how does everybody take ownership of it? How do people use their individual and collective intelligence to improve the situation? Some things are beyond our control, but it's, again, what are the things that are within our control, where one small step might make a huge difference. That notion of the butterfly effect. And Michael Rackless in Agenda for Excellence talked about a concept called Plan, Do, Study, Act, and as a way of building quality improvement into the work of health organizations and social service organizations. And the idea behind it is, start small. Take one idea that you think might make a difference, and then try it out for a while. And again, that's not just the manager making a decision or the executive director making a decision. That's the team having the conversation. And then, based on what you learn, adjust. and again, that notion of empowering teams to deal with the issues that they face is a way I think that many organizations can and do utilize. And that, again, builds a sense of connection. You don't feel like you're a cog in a wheel. You feel that you're an important part of the wheel. You're a spoke. And I think the more leaders can do to let people know that the brilliance doesn't reside only with the executive director, that your goal is building a strong team that is able to deal with issues as they arise, and also punt issues to management when it's beyond the team's ability. But having open dialogues. There's a lot of conversations in many organizations that where people are afraid to say there's a problem. I think leaders need to create a climate saying you're not going to get fired if you say something isn't working. But what I will do is, I'm going to want to hear what you say, and then I'm going to need to check with others, and we'll need a process of verification, and then we'll need a process of collective problem solving. But as we started the discussion today, I mean, we're in an environment where some of the pressures that existed pre-COVID are now exacerbated. But at the same time, we've learned that having conversations, supporting people, looking at what are the things you can do to leverage learning and opportunity virtually and service delivery. How do you support people? What are the roles of EAPs? What are the opportunities for collective action by bringing sector partners together locally? These are all things that I think people need to attend to because we do have a changing workforce. We have an environment that is still uncertain, and regrettably, governments, particularly now that if you read the news, it's all about, well, what's the deficit going to be? And so you're getting, oh, well, we'll put some money into here. We'll recruit nurses, but the structural funding issues for the sectors, unfortunately, aren't necessarily top of mind. So it's how do we do the best with what we've got? And in order to do the best with what we've got, you have to leverage the talent in your workforce and make them feel that they are important to the organization, realizing its mission, and that they know best about the situation on the ground. So how do you take that knowledge and then collectively come up with solutions? And that's again where I think we saw some of this in COVID, where here in Toronto, both the United Way and the city convened sector tables, both at a city level but also locally, to sort of share information about the effects of COVID and what people were doing to remediate. I don't think we should be finished with those kinds of mechanisms. I think it would be important to continue to have those dialogues at the community level. How do we maintain our services in a time of big challenges?
Well, Steve, it's always such a pleasure to speak with you and to hear your important insights and your terrific advice for leaders in our sector and for professionals who are working in the organizations, and for our audience of nonprofit professionals. I want to thank you for taking the time to join us and share your thoughts.
Thanks for having me, Mary, and Happy New Year to everybody.